Right, so this patient, a little bit more subtle. If you can see the abnormality, please throw it out there, because occasionally you do get someone who's a bit of a whiz and they throw it and you think, wow, that's pretty cool. So if someone can see it, go for it. Just be brave, put it in the chat, and yeah, it'd be really nice if you could do that. But anyway, when we are looking at this is a lumbar spine, right? And so the main thing to do is to try and see what the vertebral and intervertebral heights look like and make sure that they are maintained throughout the image length of the lumbar sacral spine. So that's one thing to do. And the other thing to do is, once you've kind of told yourself, okay, the vertebral heights look okay, the intervertebral heights look okay as well, you want to see the alignment. And the way to do the alignment is literally just to draw a line going along the posterior aspect and the anterior aspect. Sorry, I've done a terrible drawing, but you can see that everything's actually kind of aligned, right? So this patient actually, from what I remember, they were walking down the stairs, which I always tell people, do not be on your phone when you're walking down the stairs, because you may slip. And this is exactly what happened. This person was walking down the stairs, they slipped and went all the way down, and they had a pretty big impact at the bottom of the stairs. And since that, I've been coming in with back pain. So when you've got someone with back pain like this, you've got to be a little bit more careful and have a really good look around. So let's kind of work our way from the bottom here and get the pen function out. And so what you want to do is essentially draw square vertebra like that. And that looks okay, doesn't it? It doesn't look like there's anything abnormal there. And what we're going to do, we're kind of going to do the same thing as we go along. Next vertebra, yeah, you do have a little bit of lipping over here, and you can get that. You can get osteophytosis emerging from the anterior aspect of the vertebra, and that can be completely normal. Some of you may have spotted that there's radiolucency over here. You think, okay, you know what, we've been talking about fractures all this time. Could this be a fracture? It may be a fracture, may not be, but hang on, hold your horses. Yeah, okay, fine. There's no sclerosis as you come to the edge of this radiolucency, but have you noticed how the radiolucency goes beyond the cortex? And oh, there is a question. So I have seen your question. I'm going to come back to that. When you diagnose EC silent. Okay, so I will come back to that question. Thank you very much. So what you do is then kind of go forward, and you can see that this radiolucency goes beyond the cortex of the vertebra, and therefore this can't be a fracture, because the radiolucency shouldn't go beyond. And what therefore we have to remember is that you've got a lot of overlying bowel gas, and you can see overlying bowel gas over here. Again, on the next bit, you can see that there is some osteophytosis emerging from the anterior superior corners and the anterior inferior corners of the vertebra as you go along. Now, one thing I want you guys to pay special attention to is the cortices of the superior and inferior vertebra as we go along. As we come further and further upwards, this area over here starts to look a little bit less well-defined. You see that definition there? This one doesn't look well-defined, and if I get that pen function out, like so, you can start to feel as though this doesn't look quite right. This doesn't look normal at all. And this patient actually did end up going further and finding out that they did have a fracture in this particular area over here, which was kind of seen on the X-ray anyway. Now, I know not everyone uses X-rays, and I'm going to come to your question now. Someone has asked, how often do you diagnose, I guess, fractures on C-spines and L-spine images on X-ray? So the thing is, you have to take everything into consideration, right? Sometimes X-rays are just genuinely a way of just doing a quick look, a cursory look, just to make sure there's nothing big going on. But then when you've got a traumatic injury like this, it is important to remember the next few rules I'm going to say. So when someone's got traumatic injury, the way the human body is, if you're going to fall, and if you're going to fall, generally speaking, you're going to have an L1, T12, L1 vertebral fracture. That's more likely than anywhere else, right? It's just the way the human body folds in on itself, or where the impact seems to go. I've always seen it be about T12, L1, L2, that sort of upper lumbar, lower thoracic spine vertebra. So if you did nothing else when you had an X-ray, but only look at sort of L1, L2, T12, L1, L2, then more likely than not, you're going to pick up fractures. It's more likely than not. So when you've kind of got that sort of thing in your mind, you pay a little bit more attention to this particular vertebra over here. So if we count 5, 4, 3, 2, 1, 12. So T12, so T12, L1, L2 is usually where the body will fold. Got to be careful. If there's anything slightly abnormal, I've got to maybe think about doing further imaging. And you can see that cortex doesn't look quite right there. It looks a bit irregular at the top there. So do we routinely go onto CT scan? Again, very, very much based on the clinical symptoms and the mechanism of injury. Because as you know, or may not know, if you work at a trauma center, most people are going to get a CT scan or an MRI scan, right, with any trauma. And this could be trauma just falling from the chair that I'm at right now, or it could just be from some significant trauma. There's a wide gamut of reasons. But the fact is, as long as we're still doing X-ray imaging and expect X-ray imaging to be interpreted by us, i.e. radiologists or radiographers, then it is important to try and understand that there is the possibility of, it is important to try and identify the problems that can occur in these specific areas. So just take a closer look in that area. Okay, so that is the abnormality. So the things I really wanted to show you is how to identify possible end plate injuries, and it can be as subtle as sort of just a discontinuity of the vertebral cortexes, as you see, and everything else can look normal. In the context trauma, if the patient still has pain, you're probably going to end up doing a CT scan anyway.